detector, which is all of these electrical stems, and then I've got ultrasound. So I push ultrasound, and it's going to give me choices. And the first one is frequency. So it says 1 megahertz there. If I hit enter for that one, it changes to 3.3. So I have the choice between 1 and 3.3. So 1's for my deep heat, 3.3 is for my superficial heat. When I go down, I can do my duty cycle. I hit enter. I can do 10, 20, 50, or continuous. I'm going to probably choose between 20 and continuous. My display, I can choose whether or not the machine is giving me watts per centimeter squared or watts. That machine, if you look at the top, tells you watts. If you look at the bottom, you're looking at watts per centimeter squared. So it's got, you're seeing both on that machine. On this one, you want to pick. So most of you guys are learning watts per centimeter squared, right? So we want to, we want to switch this to watts per centimeter squared. This one actually has a head warmer, and it's off right now, so I'm going to turn it on. And I can, this head's going to start getting warm here in a second, so that I actually have a warm head to put on your leg instead of, some of that's for patient comfort, and some of that is for the patient to feel like it's actually doing something, because they actually feel something warm on their body. Some people won't feel, especially if you're doing it 20%, they're not going to feel anything. And so some people don't feel like it's working if it's not doing, if they don't feel anything. So sometimes just having the head warmer on, plus it's not quite as cold to stick on your body. So this one came up automatically at 5 minutes and an output of 1.2. So I can change my power intensity through these different choices after I've started my thing, but not until so then I hit start, and then I can start changing my intensity. All right. I don't want to do that though, even though I've got it against my hand. I'm not going to play unless I'm in contact with somebody. So that head's smaller than the other one, so my treatment area is even smaller. So probably the biggest mistake I see made in the clinics is clinicians trying to use it on too large a space, and then they're not going to get their result. And then the next biggest mistake I see is breaking contact with a person or stopping because somebody asked them a question, or they start messing with the machine. So when you're practicing, you want to get to where you feel comfortable with these machines, where you can change parameters if you need to. If the patient says, "Oh, that's too high, that's uncomfortable," I should be able to turn around here and start lowering it. Can you rub your belly and pat your head? Can you do two things at once? If not, you got to hit the pause button and change things, and then hit the start and start going again. So you can I touch you?
Yeah.
So that's quite a bit warmer than it was for you the last time, because my head warmer is heating this up nice. Okay, and they make ultrasound heads that are teeny tiny, so you can do like a TMJ or something. They make a little teeny tiny one. They make this one. That's about as big a one as you'll see. That's probably as big a head as you'll see. So that's ultrasound in a nutshell, from a nut.